count?
He doesn't count. He's not 18. Okay, this is a general informative speech on the topic of diabetes. In 2001, I was diagnosed with type 2 diabetes. I was in shock, and even though I knew developing it was a good possibility due to my family history, it still shook me to my core. It made me remember how I had to pick up 3 of my mother's toes from the bed because they had rotted off due to gangrene, and I began to cry. I knew that my life was about to change, and not in a positive way. Diabetes is a rapidly growing epidemic throughout the world, and there are many misconceptions and out-of-date information that are still being circulated. And it's my hope that at the end of this speech, you will have a better understanding of this disease. First, I would like to describe what diabetes is, if you don't already know. I want to list the types, because there are some that are not well known. I'm going to cover some basic information from the American Diabetes Association, and I'm going to talk about the effects that the diabetes has on the mind and the body. And then I'm going to just go over some brief etiquette tips for when you meet somebody who has diabetes. My main sources of information are myself, some personal friends who have diabetes, the American Diabetes Association, the National Institute of Health, and the National Alliance on Mental Illness. There's excerpts in my speech from Diabetes UK and the Canadian Diabetes Association. What is diabetes? A journal article from the Cambridge Historical Dictionary of Diseases states that diabetes is an endocrinial disorder characterized by the lack of insufficient production of insulin in the pancreas. A much easier definition in the Webster's Dictionary clearly states it's just a serious disease in which the body cannot properly control the amount of sugar in your blood because it does not have enough insulin. What are the types? The first two, maybe even the first 3 you guys are going to know. Type 1, also known as juvenile diabetes, is when people are born and their body just does not produce insulin. They have no way to get the sugar out of their system. Type 2, also known as adult onset, and a lot of misinformation is that everybody who has type 2 is overweight. Incorrect. It results from insulin resistance. You've eaten so much sugar and so many carbs and everything, and your body just can no longer fight off and send the sugar and stuff throughout your system the way it's supposed to. Gestational diabetes is when you're pregnant. You've never been diagnosed with diabetes before, but during your pregnancy, the hormones kick in. Other less common known forms of diabetes include congenital diabetes, which is due to genetic defects, cystic fibrosis diabetes, steroid diabetes, which is induced by high doses of steroids, and several forms of monogenetic diabetes. The information that I'd like to share from you from the American Diabetes Association is that diabetes is the 7th leading killer in the United States and worldwide of adults. Diabetes increases your heart attack risk. 75% of adults with diabetes will develop high blood pressure. Diabetes is the leading cause of blindness, kidney failure, nervous system disorders, and it's a contributing factor in liver disease. It's prevalent among American Indians, blacks, and Asians. Facts you may not know. 23.6 million worldwide have diabetes. 57 million worldwide are pre-diabetic. 1.6 million new cases of diabetes are reported every year. Those over 60, 1 in 4 have diabetes. Diabetes costs $174 billion, with a B, dollars annually. Most people know that diabetes can take a serious toll on your physical health. However, this blood sugar disorder can affect your emotions, and in turn your emotions wreak havoc on your diabetes. Physical symptoms include fatigue, nausea, frequent urination, frequent infections, unusual thirst, weight loss, blurred vision, and your wounds or sores are slow to heal. Yet some people have no symptoms at all. You won't even know you have it until you go to the doctor. Emotional symptoms. These are similar to the grief process. Grief being, with the diabetic, the loss of your old life. The information is primarily from personal interviews I conducted, and the emotional stages of diabetes are denial, confusion, anger, stress, bargaining, and acceptance. Chris Saladay, Nancy Mortensen, and Dominic Staples summed it up beautifully. When I'm first diagnosed, I was in total shock. My routines had to change, and so did my diet. It took me a while to come to terms with my diagnosis. It's a daily struggle, and sometimes I give up because I just no longer care. Extremes in the blood sugars cause significant mood changes. You can go from feeling wonderful 1 second to being upset, angry the next. Ask anybody with diabetes or their family members, this is true. Much has been written about the complications associated with diabetes, but the psychological consequences are often overlooked. The other issues that you have with your, psychological are post-traumatic stress, hypoglycemia, which your blood sugar drops too low, anxiety disorder, seizures, loss of consciousness. All of these things get worse as you progress down the line with diabetes. 15% of diabetic patients experience major depression. And that's all the time I have today. I hope you learned something. Thank you very much for coming.